13 Common Features of Personality Disorders. Psychology is mostly an art. There's no theory of everything from which to predict mental health phenomena. Personality disorders have recognizable traits. Most personality disorders share symptoms and signs, as observed by the mental health practitioner. Personality disorder patients they're stubborn, persistent, and insistent, except those suffering from the schizoid or the avoidant personality disorders. They demand preferential treatment, resources, and personnel. Multiple symptoms are common. They engage in power plays with authority figures, doctors, therapists, nurses, social workers, bosses, and bureaucrats, and rarely obey instructions or follow rules. They feel superior or unique. Personality disorders often involve grandiose self-perception. They lack empathy, the ability to appreciate and respect the needs and wishes of other people. In therapy or medical treatment, they degrade the doctor or therapist. Personality disorders are self-centered, repetitive, and boring. Personality disorders seek to exploit others. They don't trust or love themselves, so they can't love or share deeply. Socially and emotionally maladaptive. No one knows if personality disorders are natural or the result of a patient's environment. Most personality disorders begin as childhood or early adolescent development issues. They become dysfunctions after repeated abuse and rejection. Personality disorders have rigid traits, emotions, and cognitions. In other words, they are stable and all-pervasive, not episodic. By all-pervasive, I mean they affect the patient's career, relationships, and social functioning. Personality disorders are unhappy and often coexist with mood and anxiety disorders. Most patients have egotism, except narcissists and psychopaths. They dislike who they are, how they behave, and the destructive effects they have on those they love. Still, personality disorders are big defense mechanisms. Thus, few personality disorder patients are self-aware or capable of life-changing introspective insights. Patients with personality disorder often have other mental health issues, example, depressive illnesses, or obsessions-compulsions. They're tired of taming their self-destructive impulses. Those with personality disorders have alloplastic defenses and an external locus of control. Instead of accepting responsibility for the results of their actions, they blame others or the outside world. They develop paranoid persecutory delusions and fears. When stressed, they change the rules of the game, introduce new variables, or try to manipulate their environment to suit them. They see everyone and everything as gratification tools. Patients with cluster B personality disorders, narcissistic, antisocial, borderline, and histrionic, are egocentric despite character and behavioral deficits, emotional deficiencies and lability, and wasted lives and potentials. Such patients don't find their personality traits or behavior objectionable, unacceptable, disagreeable, or alien to them. There's a difference between personality disorders and psychoses, schizophrenia, paranoia, and the like. Instead of hallucinations, delusions, and thought disorders, the former do not. At the extreme, borderline personality disorder patients experience brief psychotic microepisodes, mostly during treatment. Personality disorder patients have clear senses, sensorium, a good memory, and a good knowledge base. Thanks for watching. Please do like, share, and subscribe for more interesting videos.